Diabetes mellitus is classified into four broad categories: type 1, type 2, gestational diabetes, and other specific types. The other specific types are a collection of a few dozen individual causes. Diabetes is a more variable disease than once thought, and people may have combinations of forms. The term diabetes, without qualification, usually refers to diabetes mellitus. Type 1 diabetes mellitus is characterized by loss of the insulin-producing beta cells of the pancreatic islets, leading to insulin deficiency. This type can be further classified as immune-mediated or idiopathic. The majority of type 1 diabetes is of the immune-mediated nature, in which a T-cell-mediated autoimmune attack leads to the loss of beta cells and thus insulin. It causes approximately 10% of diabetes mellitus cases in North America and Europe. Most affected people are otherwise healthy and of a healthy weight when onset occurs. Sensitivity and responsiveness to insulin are usually normal, especially in the early stages. Type 1 diabetes can affect children or adults, but was traditionally termed juvenile diabetes because a majority of these diabetes cases were in children. Citation needed. Brittle diabetes, also known as unstable diabetes or labile diabetes, is a term that was traditionally used to describe the dramatic and recurrent swings in glucose levels, often occurring for no apparent reason in insulin-dependent diabetes. This term, however, has no biologic basis and should not be used. Still, type 1 diabetes can be accompanied by irregular and unpredictable high blood sugar levels, frequently with ketosis, and sometimes with serious low blood sugar levels. Other complications include an impaired counter-regulatory response to low blood sugar, infection, gastroparesis, which leads to erratic absorption of dietary carbohydrates, and endocrinopathies, for example, Addison's disease. These phenomena are believed to occur no more frequently than in 1% to 2% of persons with type 1 diabetes. Type 1 diabetes is partly inherited, with multiple genes, including certain HLA genotypes, known to influence the risk of diabetes. In genetically susceptible people, the onset of diabetes can be triggered by one or more environmental factors, such as a viral infection or diet. Several viruses have been implicated, but to date there is no stringent evidence to support this hypothesis in humans. Among dietary factors, data suggest that gliadin, a protein present in gluten, may play a role in the development of type 1 diabetes, but the mechanism is not fully understood. Type 2 DM is characterized by insulin resistance, which may be combined with relatively reduced insulin secretion. The defective responsiveness of body tissues to insulin is believed to involve the insulin receptor. However, the specific defects are not known. Diabetes mellitus cases due to a known defect are classified separately. Type 2 DM is the most common type of diabetes mellitus. In the early stage of type 2, the predominant abnormality is reduced insulin sensitivity. At this stage, high blood sugar can be reversed by a variety of measures and medications that improve insulin sensitivity or reduce the liver's glucose production. Type 2 DM is primarily due to lifestyle factors and genetics. A number of lifestyle factors are known to be important to the development of type 2 DM, including obesity, defined by a body mass index of greater than 30, lack of physical activity, poor diet, stress, and urbanization. Excess body fat is associated with 30% of cases in those of Chinese and Japanese descent, 60–80% of cases in those of European and African descent, and 100% of Pima Indians and Pacific Islanders, even those who are not obese, often have a high waist-hip ratio. Dietary factors also influence the risk of developing type 2 DM. Consumption of sugar-sweetened drinks in excess is associated with an increased risk. The type of fats in the diet is also important, with saturated fat and trans fats increasing the risk and polyunsaturated and monounsaturated fat decreasing the risk. Eating lots of white rice also may increase the risk of diabetes. A lack of physical activity is believed to cause 7% of cases. Gestational diabetes mellitus, GDM, resembles type 2 DM in several respects, involving a combination of relatively inadequate insulin secretion and responsiveness. It occurs in about 2–10% of all pregnancies and may improve or disappear after delivery. However, after pregnancy, approximately 5–10% of women with gestational diabetes are found to have diabetes mellitus. Most commonly, type 2 gestational diabetes is fully treatable, but requires careful medical supervision throughout the pregnancy. Management may include dietary changes, blood glucose monitoring, and in some cases, insulin may be required. Though it may be transient, untreated gestational diabetes can damage the health of the fetus or mother. Risks to the baby include macrosomia, high birth weight, congenital heart and central nervous system abnormalities, and skeletal muscle malformations. Increased levels of insulin in a fetus's blood may inhibit fetal surfactant production and cause respiratory distress syndrome. A high blood bilirubin level may result from red blood cell destruction. In severe cases, perinatal death may occur, most commonly as a result of poor placental perfusion due to vascular impairment. Labor induction may be indicated with decreased placental function. A cesarean section may be performed if there is marked fetal distress or an increased risk of injury associated with macrosomia, such as shoulder dystocia. Maturity onset diabetes of the young, MODY, is an autosomal dominant inherited form of diabetes, due to one of several single gene mutations causing defects in insulin production. It is significantly less common than the three main types. The name of this disease refers to early hypotheses as to its nature. Being due to a defective gene, this disease varies in age at presentation and in severity according to the specific gene defect. Thus there are at least 13 subtypes of MODY. People with MODY often can control it without using insulin. Prediabetes indicates a condition that occurs when a person's blood glucose levels are higher than normal but not high enough for a diagnosis of type 2 DM. Many people who later develop type 2 DM spend many years in a state of prediabetes. Latent autoimmune diabetes of adults, LADA, is a condition in which type 1 DM develops in adults. Adults with LADA are frequently initially misdiagnosed as having type 2 DM, based on age rather than cause. Some cases of diabetes are caused by the body's tissue receptors not responding to insulin, even when insulin levels are normal, which is what separates it from type 2 diabetes. This form is very uncommon. Genetic mutations, autosomal or mitochondrial, can lead to defects in beta cell function. Abnormal insulin action may also have been genetically determined in some cases. Any disease that causes extensive damage to the pancreas may lead to diabetes, for example, chronic pancreatitis and cystic fibrosis. Diseases associated with excessive secretion of insulin-antagonistic hormones can cause diabetes, which is typically resolved once the hormone excess is removed. Many drugs impair insulin secretion and some toxins damage pancreatic beta cells. The ICD-10, 1992, diagnostic entity, malnutrition-related diabetes mellitus, MRDM or MMDM, ICD-10 code E12, was deprecated by the World Health Organization when the current taxonomy was introduced in 1999. Other forms of diabetes mellitus include congenital diabetes, which is due to genetic defects of insulin secretion, cystic fibrosis-related diabetes, steroid diabetes induced by high doses of glucocorticoids, and several forms of monogenic diabetes. Type 3 diabetes has been suggested as a term for Alzheimer's disease as the underlying processes may involve insulin resistance by the brain. The following is a comprehensive list of other causes of diabetes. Genetic defects of cell function. Maturity onset diabetes of the young. Mitochondrial DNA mutations. Genetic defects in insulin processing or insulin action. Defects in proinsulin conversion. Insulin gene mutations. Insulin receptor mutations. Exocrine pancreatic defects. Chronic pancreatitis. Pancreatectomy. Pancreatic neoplasia. Cystic fibrosis. Hemochromatosis. Fibrocalculus pancreatopathy. Endocrinopathies. Growth hormone excess, acromegaly. Cushing's syndrome. Hyperthyroidism. Pheochromocytoma. Glucagonoma. Infections. Cytomegalovirus infection. Coxsackie virus B. Drugs. Glucocorticoids. Thyroid hormone. Adrenergic agonists. Statins. A 2018 study suggested that 3 types should be abandoned as too simplistic. It classified diabetes into 5 subgroups, with what is typically described as type 1 and autoimmune late-onset diabetes categorized as one group, whereas type 2 encompasses 4 categories. This is hoped to improve diabetes treatment by tailoring it more specifically to the subgroups.